Hello students, let's study normal microbial flora of the human body. So learning objectives at the end of the session, we should know, define resident flora and transient flora, list common human normal flora, describe beneficial and harmful effects of the normal flora, and in short lab diagnosis. So normal flora, also called indigenous microbiota, diverse group of microbial population that every human being harbors on his skin and mucous membrane sites, gastrointestinal tract, respiratory tract, genitourinary tract, and skin. So types of normal flora, there are two types, resident flora and transient flora. So resident flora, lifelong members of the body's normal microbial community, closely associated with a particular area when disturbed re-establish themselves, do not cause harm, rather can be beneficial. Transient flora, microorganisms that inhabit the body surface or mucous membranes temporarily for short interval. Many are potential pathogens, example pneumococcus and meningococcus in nasopharynx can be easily eliminated by following proper hand hygiene and other infection control practices. In hospitals, patients may acquire resistant organisms as transient flora from healthcare workers and hospital environment. Example, MRSA, methicillin-resistant Staphylococcus aureus in nose and skin. Microbiology of normal flora, almost constant for an area of the body at given age, and normal flora acquired soon after birth and persist till death. Their presence depends on local temperature, moisture, pH, presence of certain nutrients and inhibitory substances, environmental flora, immune status of the individual, anatomical site, skin or mucosa. Composition predominantly bacteria and some fungi. Total population of normal flora about 10 raised to 14 bacteria, which is more than total number of cells, 10 raised to 13 present in our human body. Anaerobes are more than the aerobes. Anaerobic or aerobic bacteria varies depending upon the body site. GIT, predominant site, commonest normal flora, bacteroids, fragilis among aerobes, the Escherichia coli. The normal flora in saliva, anaerobic cocci, actinomyces, fusobacterium, bifidobacterium, the P. melanogenica, and spirochetes. Aerobic predominant viridans streptococci, then nasopharynx, the anaerobic normal flora, Prevotilla species, the anaerobic cocci, fusobacterium. Aerobic predominant streptococci, alpha and non-hemolytic, Neisseria, non-pathogenic species, diphtheroid, Staphylococcus epidermidis. Less predominant aerobic, Haemophilus, meningococcus, pneumococci, Staphylococcus aureus, gram-negative rods, and yeast. In stomach, the anaerobic are Lactobacillus, aerobic predominant Helicobacter pylori. In vagina, the anaerobic bacteria are the anaerobic cocci, Lactobacillus prevotella, Bifidobacterium, Clostridium. Aerobic predominant Corynebacterium species, Lactobacillus species, Streptococci, alpha non-hemolytic, Neisseria non-pathogenic. Less predominant Enterococci, Enterobacteriaceae, other gram-negative rods, Streptococcus epidermidis, and Candida albicans. In skin, the anaerobic bacteria are thus Propionibacterium, anaerobic cocci. Aerobic predominant Staphylococcus epidermidis, the diphtheroids, Micrococcus species, Neisseria, Streptococci. Less predominant Staphylococcus aureus, Candida species, Acinetobacter species. Beneficial effects of normal flora: prevent colonization of pathogen, compete for attachment sites for essential nutrients, synthesize vitamin K and B complex by E. coli in the GI tract, waste produce antagonize other bacteria. Lactic acid, lactobacilli in vagina of adult females maintain acidic pH. Bacteriocin, antibiotic-like substances that can inhibit or kill other bacteria. Immune stimulation, development of lymphatic tissues, example Peyer's patches in intestine, stimulate antibody production that cross-react with pathogens having related or shared antigens and prevent their entry. Complement activation, endotoxins liberated by gram-negative normal flora trigger alternative complement pathway. Prevent allergic diseases, hygiene hypothesis, lack of early childhood exposure to symbiotic microorganisms, example, gut flora or probiotics, infectious agents and parasites increases susceptibility of the individual to allergic diseases by suppressing natural development of the immune system. Disturbed normal flora promote infection. Mechanisms by which normal flora is disturbed. Injudicious use of broad-spectrum antimicrobial agents suppress the normal flora and permit pathogen to multiply and cause infection. Example, Clostridium difficile causing pseudomembranous colitis because of the injudicious use of the clindamycin. Host factors, immune suppression, reduce peristalsis, promote pathogen to grow. Physical destruction of normal flora, irradiation, chemicals, and burns. Inoculum size of entering pathogen is high, then it can dominate over the normal flora. Minor trauma in mouth, example, dental procedure, chewing, or vigorous brushing. Entry of small number of bacteria, example, Viridia and Streptococci, transiently into bloodstream causes bacterial endocarditis. Harmful effects of normal flora may be agent of disease, endogenous disease. When the host immunity is lowered, example gram-negative organisms colonizing the respiratory tract causes pneumonia. Entry into wrong site or tissue, example blood, sterile body cavities, disease causes disease, E. coli intestinal commensal causes urinary tract infection. Transfer to susceptible host, pathogens that colonize the upper respiratory tract, meningococcus pneumococcus can produce disease in susceptible host. Bacterial synergism, bacterial vitamins and growth factors may promote the growth of potential pathogens, contribute to drug resistance of pathogens. Normal flora produce enzymes such as beta-lactamases, which destroy beta-lactam antibiotics. Competition for host nutrients. Diseases produced by normal flora. Urogenital infection, urinary tract, organisms, E. coli, Klebsiella proteus, endocarditis, oral flora, Streptococcus viridans, dental caries and periodontal disease, oral flora, Streptococcus mutans, peritonitis, abdominal infection, intestinal flora, pneumonia, transient respiratory flora, septicemia from any side. Infections in mouth and organisms. Dental plaque, Streptococcus mutant, Lactobacillus. Dental caries, Lactobacillus. Periodontal disease, gingivitis, Pyrrhotella, Porphyromonas, gingivalis, Treponema dentocula. Dental root canal infection, Porphyromonas endodentalis. Ulcerative gingivitis, Vincent's angina, Leptotrichia buccalis. Laboratory diagnosis, specimen dip aspirates tissue bits. Collection and transport, RCM broth, needle and syringe with rubber bunk. Steward transport medium. Macroscopic examination of specimen, foul odor, purulent appearance of fluid specimens, presence of necrotic tissue, gas, sulfur granules. Microscopy, gram stain, many pus cells, variety of different microorganisms. Culture media, blood agar, kanamycin, vancomycin blood agar. Thioglycolate broth or RCM, Robertson cooked with media. Culture methods, anaerobic jar, gas pack, bactec, anaerobic blood culture system, antimicrobial susceptibility testing. Treatment, surgical drainage of pus from abscess, wound debridement, curettage and removal of necrotic tissues, antibiotics, metronidazole, penicillin, forcocci, clindamycin, cefamycin. Prevention, reduction in microbial flora, proper oral hygiene, use of antimicrobials, regular brushing of teeth, control of dietary carbohydrate intake, improvement of tooth resistance, fluorides, diet, toothpaste, removal of dental plaque, scaling.
Hope you find this session useful for your understanding and for your exams. Thank you.